The CTSC is part of a national program that's designed to facilitate clinical research. They were looking for programs that are designed to enable investigators to take their discoveries from the bench to the bedside, and also to take discoveries that have been proven in initial clinical trials into the community and into the population. We provide the academic home, and we provide also the coordination, leadership, and the collaborative spirit that we think marks Case Western Reserve University.
I'm interested in asthma in children, and particularly in children who are living in urban areas in Cleveland, because asthma is more common and also more severe in that population. But through the CTSC, I have access to experts in a variety of fields, and having access to all these people really helps me to think more broadly about the problem and address it in a much more multidisciplinary manner.
What I want to know is, what is it about your culture that affects how you take care of yourself? Our hope is that we can get the patient to recognize that they are the best controllers of their health, and ultimately reduce that gap between the people who are of different cultures and the health care that they receive.
Nowadays, the simple questions, many of them have been addressed. We're now addressing much more complex questions, and we're doing much more teamwork.
Research is very hard to learn how to do, and what they provide is access to some of the best researchers here in Northeast Ohio. They are actually committed to meeting with us weekly to help us move our research forward. And I think without that, my project would be very hampered and probably almost impossible to do.
I think that this is going to be the single most valuable aspect of the CTSA, because it is going to be the entry point into all the resources of the CTSA for anyone who wants to use them. And we're proud that Case Western Reserve has developed it, and we think it's going to wind up being a prototype for other centers too. So it's really very cool.
I also have had opportunities to develop community-based programs for research, and that probably would not have happened without their encouragement to translate our research to the patient and to the community overall.
There are 130 medical schools around the country, and I think the early receipt of the CTSC at Case Western Reserve bespeaks our prominence in clinical research and the expectation that we will be among the leaders in translational research.